morning. My name is Kaci, and this is Jason, and I will be performing my on Jason this morning. Prior to every exam, I can be sure available. We obtain the vital signs, height, weight, visual, chart, air visual, chart, which were all within normal limits. Now I will move on to inspection of his face and his head. His head is rounded, normal cephalic. Looking at the skin on his face, it is uniform in color. There are no lesions noted. Now I will palpate his head and his scalp. The scalp's easily movable. It's free from nits. There's no indentations, masses, or bulging noted in the on the skull. The hair is smooth and it's blonde in color. It does not easily pull out. Now we'll move on to palpation of the facial bones. Do you feel any tenderness at all, Jason?
Nope.
Now I will move on to palpation of the TMJ. Have you open and close for me? No popping or clicking, no discomfort indicated. Now I will move on to palpation of the sinuses, the frontal sinus. Tell me if you feel any discomfort. Maxillary sinus. Any discomfort?
Nope.
No discomfort noted, which is a normal finding. Now I will move on to for me. Close your eyes tight. Open them. Puff out your cheeks. Push your lips. Blow out. Smile. Clench your teeth. All movements of his face are symmetrical, which indicates that cranial nerve number 7 is intact. Now I will move on to postcranial nerve number 5. Jason, if you could tell me that you feel both sensations on your, close your eyes for me. Where do you feel this?
Forehead, cheek, chin, cheek, forehead, forehead.
Do you feel those equally on both sides?
Yes.
Okay. Now moving on to test discrimination. Can you tell me if you feel soft or sharp?
Soft, sharp, soft, sharp, soft, sharp, soft, sharp.
All of those feelings are within normal limits. He feels them equally on both sides of the face, so that's symmetrical, indicating that cranial nerve number 5 is intact. For sensory portion, now feeling, clench your teeth for me. Okay, move your jaw side to side. This is the testing the motor function of cranial nerve number 5, and that's also intact. Now moving on to inspection of the eyes. The eyes are symmetrical. Looking at the sclera, it is white. There's no jaundice noted. The conjunctiva is pink and moist and intact. There are no lesions noted. Looking at the eyelashes, the eyelashes curve away from the orbit. The eyebrows are growing out past the outer canthus on both sides, which is a normal finding. Now palpation of the lacrimal apparatus. There is no excessive tearing or exudate, which is a normal finding. Now I will move on to do some testing on the eyes, looking at the patient's pupillary response. Jason, I'll have you look up at me. Testing direct. His direct response is normal. Consensual response is normal. Other side. Direct response is normal. Consensual response is normal. Now I will move on to looking at consultation testing. I will get behind Jason. Can you please tell me whenever you see my fingers?
No.
That is equal on both sides. His peripheral vision is intact. Now moving on to the cover uncover test. Jason, if you could focus on the picture ahead of you. Now cover one eye for me. Now uncover. Now cover the other eye. Now uncover. There's no strabismus or extraocular movements noted whenever he does this test, indicating that the cover uncover test is within normal limits. Now if you could focus on that picture again for me. Now focus on my finger. Now the picture. Now my finger. When he focuses further away, it dilates. When he focuses closer to him, his eyes or pupils constrict, which shows that his eyes do properly accommodate. Now testing extraocular movement. Jason, without the pen light on, can you follow my pen light for me? Do not move your head, just your eyes. Now converge to the center. He moves through all of those movements equally on both sides. No evidence of strabismus, and he did pupil constriction upon convergence. This indicates that cranial nerve which is a normal finding. Now I will move on to inspection of the ears. General inspection of the ears. The ears are equally set. They are in line with the outer canthus of the eye on both sides, which is normal. The skin is intact. There are no lesions noted upon palpation of the arcles. No mass is felt. The skin is warm and dry and uniform with the skin on the face. Now looking at the inside of the ear, I will note that inner ear canal does have some cerumen. Looking at the tympanic membrane, it is pearly gray to white in color with light reflex present. There are no perforations or redness. Moving on to the other side. Same on this side. Small amount of cerumen. Tympanic membrane is visualized. It's pearly gray white in color, light reflexes present, no perforations or redness. On either side, and behind Jason, I will have him cover his right ear, and I will whisper a word, and I need you to tell me what I say.
Orange.
Other side.
Apple.
He did repeat those phrases correctly, which indicates that his hearing, as far as the whisper test is concerned, is normal. Now on to the liver test. I will strike the tuning fork and place it in the center of his head. Jason, I need you to tell me where you hear the sound.
Both ears.
That's a normal finding. Now I will move on to the rim test. Strike the tuning fork. Place it on the mastoid bone. Tell me when you no longer can hear the sound.
Done. Done.
Okay. Air conduction is longer than bone conduction, which was on this side, now this side.
Done. Done.
So his rim and liver test were within normal limit. Air conduction was longer than bone conduction. Now moving on to inspection of the outer nose. The skin is uniform in color with the rest of the face. There's no visible lesions. There's no redness or swelling. Upon palpation of the nose, I also do not feel any lesions. Now I will use my otoscope to look at the inside of the nose. If you could look up for me. Look Looking at the nasal mucosa, it is pink and intact. There is some nasal drainage. Patient does have sinus drainage issues first thing in the morning, but the turbinates are intact. There's no perforations, and the septum is not deviated. Same findings on the other side. The nares are oval and symmetrical on both sides. Now I will have Jason cover one nostril. Take a deep breath in. Other side, out and in. He does have some drainage noted on more on the left than the right, but they are patent, which indicates a normal findings in the nose. Now I will move on to check the mouth. The lips are moist and intact. There are no cracks or lesions noted on the lips. Looking inside the mouth. Open your mouth for me, please. Looking inside the mouth, the oral mucosa is pink and intact. Lift up the tongue for me. The ventral side of the tongue is pink, smooth, intact. Frenulum is also intact. Bring your tongue down. The dorsal surface of the tongue is has like a rough appearance, but is pink and intact. Now I will have you say ah for me. Uvula raises midline. Oropharynx is pink and intact. Posterior pharynx is pink and intact. Tonsils are present. Grade 1 tonsillar pillars are intact. There are no perforations noted. Now I will test the gag reflex. The gag reflex is present, and I will have you stick out your tongue for me and move it side to side. And I will have you put your tongue inside your cheeks, move side to side. Okay. This indicates that cranial nerve function is present for cranial nerves 9, 10, and 12. If you could also move your tongue up towards your nose and down towards your chin. Perfect. Now, moving on, also noting that there is no odor in the mouth upon now moving on to inspection of the neck. The neck is symmetrical in musculature on each side. And I will then move on to palpation of the carotid arteries. They are strong, grade 2 on both sides. Now I will check for tracheal position. It is midline and there is no tugging noted. Now I will have the patient from the posterior aspect. I will feel the thyroid, have the patient take a swallow. The thyroid is smooth and free from any lesions. Now I will auscultate the carotid arteries and the thyroid. With the stethoscope, take a deep breath in for me and hold. Now you can breathe in and then hold. No buoy auscultated. Now I will listen to the thyroid. Deep breath in and hold. No buoys auscultated in either thyroid. And also there is no obvious regular venous distension on either side. Now motion in the neck, passive range of motion. If you can move your head back for me, chin to chest, ear to shoulder, ear to shoulder. Now, if you could, I will test these with resistance. Move your ear to your shoulder. Same on the other side. Head back. Chin to chest. Good. Muscle strength is equal on all sides. Now, if you could shrug your shoulders for me. Now, shrug your shoulders against resistance. Muscle strength is equal on both sides, which indicates a normal finding, indicating that cranial nerve number 1 is intact. Now, I will move on to the lymph node. Move your head back for me. Occipital, postauricular, preauricular, posterior cervical chain, anterior cervical chain, move your neck towards deep cervical chain, other side, deep cervical chain, tonsillar, submandibular, submental, supraclavicular, infraclavicular, axillary. Noting if I feel any enlarged nodes or if there's any tenderness, which there was not, and that's a normal finding. So now I will move on to the section of the upper extremities. Looking at the upper extremities, the muscle tone is equal on both sides. The skin is intact. There are tattoos noted on each upper arm. Otherwise, the skin is uniform in color with the rest of the body. Looking at the patient's hands, the skin on the hands is uniform with the arms. The nails are intact. They're pink and they are hard. They do not easily move away from the nail bed. They do not easily lift up. Capillary refill is within normal limits. Palpating radial pulses. They are equal and strong 2+ bilaterally. Radial pulses. Equal and strong 2+ bilaterally, which is a normal finding. Now testing strength. Jason, you could grab my hands as tight as you can. Don't let me push up. Turn your hands this way. Don't let me push down. Muscle strength is equal in both upper extremities, which indicates normal findings. Now I will move on to inspection of the anterior chest. Looking at Jason's chest, rise and fall when he is taking respirations is symmetrical on both sides. Skin is intact and uniform with the rest of the body. There are no lesions noted. Now I will move on to palpation. Palpate the precordium for any heaves or lifts. Palpate the apical pulse, and it is regular, 2+. Now I will palpate the tactile affirmative. Have you repeat the phrase 99?
99, 99, 99, 99.
Vibrations are felt equally on both sides. Tactile affirmative is within normal limits. Now I will also breath out. Deep breath in and out for me, Jason. Breath sounds are equal on both sides. Now I will check for expansion. Take a deep breath in for me. My hands move equally on both sides, which indicates that there's equal expansion of the lung field. Now I'm going to test the lung field. All sounds are equal on both sides. There resonance noted. Usually the heart is for purposes of examination. Now I will listen to the heart sounds with the diaphragm and my stethoscope. Aortic, pulmonic, Erb's point, tricuspid, mitral. Now with the bell of my stethoscope, aortic, pulmonic, Erb's point, tricuspid, mitral. Now I will have the patient lay down for me, please. Listening again in all spots with the diaphragm and bell of my stethoscope, aortic, pulmonic, Erb's point, tricuspid, mitral. And with the bell, aortic, pulmonic, Erb's point, tricuspid, mitral. Now if I'll have you turn on your left side for me. Aortic, pulmonic, Erb's point, tricuspid, mitral. All sounds are normal. F1 and F2 are present. F3 or F4 activated. Now I will move on to inspection of the abdomen. Looking at Jason's abdomen, the contour is rounded. There are no pulsations noted, and no bulging of the abdomen noted. Now I will auscultate the abdomen. All four quadrants with the diaphragm. Listening for longer if I do not hear sounds, but I do hear them. They're equal in all four quadrants. They're present, and they are normal. They are not hypo or hyperactive. Now I will move on to auscultation of the arteries, aorta, renal, iliac, femoral. No Brie auscultated upon listening to any of the microarteries noted in the abdomen. Now moving on to percussion. I percuss all four quadrants. Noting that I hear tympani in all four quadrants. Now I will grab my tape measure and I will percuss for splenic dullness or liver dullness and liver borders. Midclavicular line. Where I hear dullness. And then I will go where I no longer hear dullness. And I will measure. And that is 8 centimeters, which is normal. Normal is 6 to 10. Now I will percuss for splenic dullness. Splenic dullness is present. Now I will move on to palpate the aortic pulsation. I can feel it, but it is not bounding. Rhythm is regular. Now I'm moving on to palpate the liver. Have Jason take a deep breath for me. In and out, in and out. Feeling for the liver. The liver is smooth. There are no masses felt. Now moving on to the spleen. I should not be able to feel the spleen. Deep breath in and out. And I cannot. This is a normal finding. If I could feel the spleen, it would indicate that it's enlarged and protection needed to be done. Now I will move on to palpate the kidneys. Deep breath in and out. This will displace the organs and you can feel them better. And they're smooth on both sides, which indicates a normal finding. Now I will move on to light palpation of the abdomen. Please let me know if you feel any tenderness at all. Deep palpation. No masses felt in the abdomen upon palpation. The patient did not indicate any tenderness. This is a normal finding. Now I will have Jason sit up for me. And we will look at his back. If you could sit with your back facing the camera, please. Thank you. Looking at inspecting the skin on Jason's back, there is some acne noted, otherwise it's intact and color is uniform with the rest of the body, which is a normal finding. Now, and looking at him when he takes respirations, it's unlabored and equal chest rise and fall on both sides. Now I will look for thoracic expansion. Take a deep breath in for me. Again. My hands move equally on both sides, which indicates a normal finding. Now I will palpate for tactile primitives. Could you please repeat the phrase 99?
99. 99. 99.
Lift your arms up for me.
99. 99.
Vibrations are felt equally on both sides. Now I will test all lung fields. Upon percussion, I hear resonant sounds equal on both sides. Now I will auscultate. Deep breath. Comparing each side. Breath sounds are clear. Testicular sounds heard. In all lung fields, lift your arms up and touch your head. Deep breath. Same with the lateral aspect of the lung field, which indicates that this is a normal finding. Now I will move on to percuss or diaphragmatic excursion. Jason, if you could take a deep breath in and then blow it all out for me and hold. Okay. Now take a deep breath in and out, and then in and hold. There's some holding the lower mark for me so that I can measure between these two spots. And normal is 3 to 5 centimeters, and his is 5 centimeters, which is normal for time's sake. We will just do one side for diaphragmatic excursion. I will have Jason turn on the table facing the camera. Looking at Jason's lower extremities, hair distribution is equal on both sides. Skin is intact. Looking at his feet, his skin is intact on his feet. His nails are hard. They do not easily move from the base. They are pink. Capillary refill of less than 3 seconds. Palpating the pedal pulses. 2 plus on both sides. Tibial. Popliteal. 2 plus bilaterally, indicating that this is normal. Now I will test reflexes. I'm looking for quadriceps and present on both sides. Now, brachioradialis. The hands move. There's movement on both sides. Now I will test my Achilles. And there's movement on both sides. And the reflexes are 2 plus. Now I will stand for me. Bend your knees. Back up. Did you have any pain when you did this?
No.
Have you bent over and touched your toes, looking at spine configuration and palpating? Spine configuration is normal. There's no deviation of the spine, no evidence of scoliosis, kyphosis,